Hi, everyone. I hope you're all doing well. Today, we are here with our new series, which we had discussed about last time about medical astrology. So I welcome Kṣaṇāti, and today we're going to be discussing a short video on what medical astrology is, and then we'll do the different parts over the different signs and planets. Welcome, Kṣaṇāti. How are you?
Namaste, Navjeet. It's such an honor and pleasure to be here with you and our astrological community, starting a new series on Medical Jyotish. Medical Jyotish is a very deep and ancient aspect of Jyotish. A lot of times when people are first introduced to Jyotish, they're introduced to it from a predictive perspective. When am I going to get married? When am I going to start making money? What kind of job should I have? And there's a lot of predictive methods that are used. Medical astrology is also predictive in its nature in terms of it shows us vulnerability to certain diseases. But based on the doshas that are influencing those diseases, we can also understand the remedies. So in our series, we're going to go over each planet, the diseases associated with the signs that rule that planet, the primary houses that that planet targets when it comes to disease. And then we're going to discuss Ayurvedic remedial techniques to apply to all of those health issues. So this series is remedially based to understand what are the health vulnerabilities based on your chart, what are the doshic influence on those different organs depending on the planet, and then what remedies can we apply Ayurvedically using certain diet, using lifestyle, using herbs to help bring rejuvenation and healing to those medical challenges. But today, we're just going to do a brief introduction to medical astrology so everyone can get excited for our series.
Yeah, that sounds great. Yeah, I think it's really, really nice with medical astrology just to really see, like looking at someone's chart and just to see what they're prone to, their health issues, and then they can focus on. I think can save them a lot going to a naturopath and other places. Seeing the chart gives you a lot of information.
Yeah, definitely. And so even if you don't have health problems, let's be honest, we're human beings here and we're going to have some kind of health problem eventually. And so understanding those vulnerabilities, when you use the science of longevity, Ayurveda, you're not only helping reduce the possibility of the last stages of disease when it comes to your vulnerability, but you're also ensuring your longevity. There's a great sutra I'd like to introduce to our topic, Dhammartakama Mokshanama Rogalamumam Uttamam Rogasya Tarha Shreyasho Jivatasya Cha. The purpose of Ayurveda, and this is very deeply connected to Jyotish, is so that by ensuring the greatest longevity and balance of our health, that's what's going to allow us to have the most time to achieve dharma, our purpose, artha, our material, kama, our soul's desires, and moksha. And so it's actually by ensuring our longevity and the pacification of our doshas that we're actually allowed to achieve the 4 Vedic aims of life that Jyotish encourages us to pay attention to and to strive for. So the intention of this series is for all of our followers to help achieve dharma, artha, kama, and moksha through the understanding of medical Jyotish.
Beautiful.
So first, it's just some generalities. Each planet has a doshic influence. And when we're talking about the doshic influence of each planet, it can vary sometimes with certain planets, but there are certain generally Vata planets, certain generally Pitta planets, and certainly general Kapha planets. And for those of you who aren't familiar with the Ayurvedic Doshas, the 5 major elements come from the descension of consciousness into matter. This is Sankhya philosophy. And when that 5 elements from the Mahabhutas comes down into its physical form, they actually join in union with each other as they come into this earthly plane. And so the 5 major elements are space, wind, fire, water, and earth. But when they come into the earthly plane, they conjoin. They have a yoga and the union. And that's where the doshas are created. So the first dosha is Vatadosha, which is a combination of ether, space, and wind elements. There's Pitta dosha, which is a combination of fire and water, but not cool water like we understand a river. We're thinking of liquid magma, hot, oily water. And then we're also understanding Kapha dosha, which is that cool water combined with the earth element. And so every single human being has a unique constitution of doshas within their physical body. And based on the balance of those doshas, you have vitality and you have longevity. But based on your doshic constitution, you're going to have certain health vulnerabilities and you're going to have certain strengths. And so we're going to understand what those vulnerabilities are and how to remedy them. So first, to understand your constitution, if you take a look at the chart that I have here on the screen, there's a Indian chart, and then there are the different body parts and associations. Now, the first house is where you find the basic constitution of the individual. That's the inherent prakriti, the birth constitution of the native. This can be found as a balance of vata, pitta, and kapha within the body. So depending on the planets that are there, that's going to be the influence. This has different body parts, and I'm just going to go over the different body parts because if you have a malefic, a low dignity, a debilitation in one of these positions, you're going to have challenges there. Maybe if there's an exaltation and some strength there, you could have what's called asti sar, or a different sar of the various dhatu associated with it, which means you're blessed in that area. So to understand a little of the strengths and weaknesses of your physical body based on the alignment of the Vedic chart. First here is the constitution, which is your basic balance throughout your life. But this is also the head. The first house is the head, and that's where you get issues with the head and the brain and the mind that can show up here. But you can have specific issues with like headaches, as mentioned here, the face, the skull. For example, if you're born within a lunar eclipse or a solar eclipse and it's in your ascendant, Dr. Lad had a client who was born with the solar eclipse in their ascendant. They were born with alopecia, right? Their complexion was totally destroyed. And Dr. Lad had to do a series of remedial rasayanas to improve the skin quality, to improve the skin tissue. So this is also the hair, right? So I'm a Rahu in my first house, and that's where these dreadlocks come in. It's really easy to have those associations. And mental problems, because the head is the mind. And so, you know, Moon Rahu conjunction in the ascendant can be difficult. Debilitation of Mercury in the ascendant can be difficult. So we have to understand it can affect the mind as well. As we move to the second house, we start to get into the eyes and the mouth, right? The second house is the mouth. It's what we put in it. Mouth diseases. So, you know, people like to smoke cigars with certain Mars or Rahu in the second house. They got to be careful of oral cancer. You can have teeth issues associated with here. And it's also the throat from its communication expression. So we have to understand that there could be difficulties here, throat cancers, mouth cancers, issues with the teeth cavities and things like that. And also the vision, the eyes, you know, the certain debilitation of a planet right here. Let's say you got Mercury debilitated, you might have to be wearing glasses. This is just a common association. And we'll go more into detail. The third house is the ears, specifically the right ear. And it has to do with the right eye mostly, but a lot of eye diseases come from the second house as well. And this is generally ear problems can show up here. For example, it's generally associated with the ears. And so this is the right ear in the third house, and this is the left ear, just like this is the 12th house left eye, and the second house is the right eye. But you will find associations with general eye issues in the second house and general ear issues in the third house. So this is something that can show up here. Maybe you have hearing difficulties. Let's say you're getting a little bit older. You're wondering which of your ears in general, are you going to lose your hearing? Which ear is going to go first? You can look at the third house or the 11th house to understand. Now we're moving on to the fourth house. The fourth house is Avalambaka, Kapha, the lungs, the heart. It's not the heart, the chest area. And so you do find some heart-related issues here, but you can also find those in the fifth house. And this is where you can deal with issues of the lungs, right? You can deal with lung cancer. You can deal with bronchial, you know, breathing issues. You can deal with asthma. This is where this chart stuff shows up pretty strongly. The fourth house can also relate to certain digestive problems, particularly in the stomach area. And this has to do with also the blood, right? The circulatory system. And that kind of happens between the fourth and the fifth house, but we can see that too. The 5th house has to do with the spine and specifically the function of the heart. So this is where you can have heart murmurs, heart challenges. You can have issues with the heart valves, right? A different, like where the heartbeat is off. And this has to do with also some liver problems, cirrhosis, certain difficulties in those areas. And as you move into the 6th house, you can deal with certain kidney issues, the colon, right? Colon cancers, the large intestine as it goes into the colon. And this is where you can find certain polyps, certain predispositions to certain digestive issues like ulcerative colitis, irritable bowel syndrome. You have to be careful with that stuff in the 6th house. The 7th house has more to do with some of the private parts, right? The yoni for the woman and the shukra for the male, but not specifically sexually transmitted diseases, but actually issues in those areas. So women can have ovarian cysts, you know what I mean? They can also have fertility issues. This can show up in this area. And you also have issues with the waist. Lower back pain can show up here, right? A lot of people suffer with lower back pain. And just like how the 1st house has to do with the complexion, you can also deal with some skin-related issues in the 7th house as well. The 8th house has more to do with venereal diseases, right? So sexually transmitted diseases. You can have issues in the reproductive organs. This can also affect the fertility. But you must be very careful of unprotected sexual activity if you have a vulnerability in the 8th house, because you're going to have a predisposition to contracting a sexually transmitted disease like syphilis or gonorrhea or something much more serious like HIV or AIDS. So you got to be really careful with the 8th house influence there. The 9th house has to do with the joints and what connects like the elbows and the hips. And it's also generally the Asti Dhatu, so the bone structure, the skeletal structure. My moon in Venus is in Libra there. So when I got tested for my different Dhatus, Dr. Lad said I was Asti Sar. So of all the tissues in my body, the bones are the strongest. That's what helps grow the hair. I've never had a cavity. So you can find this issues with the strength of the bones or the weakness of the bones, right? Arthritis, osteoarthritis, and different bone issues. And we'll talk about remedies like Abrak Basma and different things that you can do to empower the bones. The 10th house has to do with nerve diseases. This is where you get blood issues, but it's specifically the knees shows up in the 10th house. And you can deal with certain things like I'm allergic to certain pollens. I'm allergic to dust. I'm allergic to certain animals. That shows up in the 10th house. Like my Mercury is heavily combust in the 10th house. I'm allergic to cats. So that's something that shows up here. And this also, just like the 4th house can have to do with blood challenges, the 10th house can have to do with blood challenges. You're dealing with the central channel of the body here. So you're really dealing with a lot of general issues. And this can actually show up as Majadatu, which is the nervous system. Certain things like anxiety. Maybe you have a panic disorder. Fibromyalgia shows up in the 10th house. You can also find other diseases like Parkinson's disease. And we'll provide certain remedies for that. There are certain herbs that can help balance those vibrations and energies in your chart. So just to consider that, like a Pikachu is a really balancing herb for the 10th house and some nerve issues there. Atmagupta, it's also called. As you get into the 11th house, you find certain things on the left side of the body showing up, the left ear. It's also the legs, right? So if you have certain issues, maybe you have certain trouble with balance, right? Certain things in the 11th house show that, I have Saturn in the 11th house. So my legs are a lot smaller than the rest of my body. Especially the bottom part of my legs. So you can kind of see the distribution of mass as it shows up with the different organs too. And the different positions in the Jyotish medical astrology. And then the 12th house is the bottom of the feet. That can do with the lymphatic system and also sleep, which is like insomnia related issues. And it says system diseases here. And that's when I want to break down a little bit of another aspect of medical astrology. And so in Ayurveda, there are 6 stages of disease. And this is important to understand in Jyotish and medical astrology, because certain things have a vulnerability in early stages and certain things have a vulnerability in later stages. So if you take a look at the 6th house here, the 6th house is the first 3 stages of disease, which is called Vikriti. This is when the dosha gets out of balance. Vata is high, anxiety. Pitta is high, anger. Kapha is high, laziness. These are just some examples of little subtle energies that start to influence things in the negative way. And usually that's what sets up long-term disease. Of course, there can be certain fixed karmic predispositions to long-term disease, and we'll look in the 8th house and the 12th house for those, but it's really not going to show up if you can keep your 6th house, the Vikriti, the slight imbalances of the dosha of the body, in balance. So Sanchay is the first stage of disease, and that's when you start to get a little angry if it's Pitta. You start to get a little anxious if it's Vata. You start to feel a little slow if it's Kapha. This is the start of death. Believe it or not, these subtle emotional changes in our body are actually sending a signal into our body that we're out of balance. And no disease actually manifests, even if you're genetically predisposed to it, unless those doshas get out of balance. The genetic predisposition is when it starts to get out of balance, how severe does it get quickly, right? And we can see that through the 8th and the 12th house. But Sanchay, the influence of the increase of the dosha, that's how it all starts. Then there's Prakop, where it's not just irritated, but it's accumulating, right? Now the dosha is getting, we're not just angry, we have an anger problem, we're fierce. We're not just a little bit anxious, we're having panic attacks. We're not just lazy, we're overweight. We're starting to show more physical signs of these issues as things go from Sanchay, the first stage of disease, to Prakop, the second stage of disease. So then, we get prasar, which means now that things are accumulating, it's circulating throughout the body, right? So now it's not just contained in one organ, it's actually circulating through all the body. And what happens is this still takes place in the 6th house. But what happens is when that dosha starts circulating in the body, it wants to find a weak dhatu. The dhatu are the 7 major tissues, right? We have rasa, the plasma, rakta, the blood. We have the maja, this isn't in order. It's actually the fat, the muscle, the bones, the nervous system, maja, and then shukra or artava, which is the reproductive organs. And so they kind of happen in that order. But what happens is based on the 8th house or the 12th house, which I'll get in a little more detail in a second, it's going to find the weak dhatu, right? So for example, I'm astisar. My bones are strong, right? So it's not going to go into my bones, right? Because it's not a weakened space. But a weakened space in Ayurveda is called a kave gunya, which translates to the defective space. And that can be genetically, or it could be because there's trauma to that area. And so then it'll deposit there. So for example, if it's, let's say that there's a Vata pushing Pitta. Vata and Pitta are really high in the body, and you have a genetic predisposition to leukemia in your family. Let's say your family has a history of leukemia, which takes place in the Rasa and Rakta Dhatu. When the Vata and Pitta start getting excessive in the Prasar stage of the disease process, they're going to say, hey, here's a Dhatu that of the blood and the lymph that we can deposit into. And again, you might be able to see this in the 12th house or the 4th house or the 10th house. Maybe there's a vulnerability there that we can see in the chart, and it's going to start to deposit there. And that's when you get into the 4 stages of disease, sthana shramshray, which means the excessive doshas are so rapidly high that now they're going to deposit in a physical tissue. That's where you see the 8th house, which is the vulnerability to sometimes the latter 3 stages of disease. Sthana shramshray, which means it's depositing in the tissue. Vyakti, which means it's not just starting to go in and out of the tissue, it's permanently in that tissue. And at this point, you need something like panchakarma even some of the primary things that we're going to talk about, like diet, urban lifestyle, they might not be enough at this point. When you get to that 5th stage of disease, Vyakti, this is when you need panchakarma, and you need to make a complete revolutionary change of your lifestyle. Once the tissue begins to change, diet's not going to change it. It's a great start to prevent it from not getting worse, but you need some more serious Shodhana therapies that we can find through panchakarma. And then there's beta. And beta is when the doshas have deposited in a specific tissue and they're there for such a long period of time that they make permanent damage to the tissue. This is when, for example, if a woman has ovarian cyst and it turns into cancer, after that cancer, that tumor has grown and it's malignant, she's probably not going to be able to have children again. That's when there is this permanent effect, right? So we have to understand, once the lungs have gotten cancer, they're going to be weak for the rest of your life. You can remove the cancer, but that doesn't mean that your lungs will ever be as strong as they used to be. You know, a good example of this was, I was living in Aruba when I was a young man, and there's lots of, you know, food carts. And I wasn't a vegetarian at this time. And I went in Aruba. It's close to Suriname, and they got all kinds of delicious Indonesian food. So I went and I got chicken satay, and I love the late night chicken satay. The peanut sauce is absolutely delicious. So I get it. 2 days later, I wake up, you know, grabbing my stomach. I can't move. I can't get out of bed. I have 104 fever. I went and got tested. I developed salmonella poisoning. At this point, the salmonella had gotten so serious, and through diet and herbs and medication, I cured the salmonella. This was back in 2009. Still 11 years later, my stomach is not as strong as it was before I got that salmonella. It created a permanent damage for the rest of my life. This is because that disease, that pitta of the salmonella, got so serious in my stomach. And as a Rahu K2 ascendant, I had the vulnerability to that. We'll talk about that when we get to Rahu. As a result of that, my probiotic count has been down. I always have to stay on top of my diet. So this is something that is an understanding of how, when something creates a permanent change in the beta stage, even when you heal it, there's still the scar tissue, and then it's a kave gunya even more, right? It creates another defective space where I won't dare ever to eat street meat again, right? Learn my lesson there. So, and then just to touch on it, the 12th house, the first 3 stages of disease take place in the first 3 house. I mean, in the 6th house, the 2nd in the 8th house, which means when it gets out of whack, what diseases are going to show up. And we'll talk about in a second the different signs. It's an easy association. The 12th house says system disease. This has to do with the genetic predisposition, right? Diabetes in the family, you can show the kapha issues showing up in the 12th house, maybe a debilitated Jupiter. We can see certain energies that are showing up as kind of the predisposition, which doesn't mean that you're going to get it, but that you're likely to be vulnerable of it. If the 6th house and the 8th house get out of balance, it's going to trigger the systematic or lifelong illnesses of the 12th house. So we just have to consider that. Now, associated with each of these houses is a sign, and associated with that sign is the different diseases. And so when we go over the different planets, for example, Mars has Aries and Scorpio associated with it. So it's going to deal with issues of the 1st house and the 8th house. So, and there are different organs associated with that, like Ranjika, which is the liver. So there are other things that show up here. But again, Aries has to do with 1st house diseases, Taurus 2nd house, Gemini 3rd house, Cancer 4th house, Leo 5th house, Virgo 6th house, Libra 7th, Scorpio 8, Sagittarius 9, Capricorn 10, Aquarius 11, and the Pisces 12. So when you're looking at some of this, you can start to make an association. Now we're going to go over each planet. So if you have a certain planet in one of these houses and you have a certain sign in one of these houses, please stay tuned for our future discussions on medical astrology, where we're going to address each and every potential issue here, depending on the planet and its association. So you can see your vulnerabilities, and then we're going to give remedies of how to fix them. So we're going to start with the sun, and we're going to discuss how the sun is a Pitta planet, but depending on what signs it is, what are the other doshas that can come into challenge here. And we're going to get into that in thorough detail. So this is just a brief introduction on medical astrology, but I'm very, very excited to get into this elaboration on how we can help our community with their medical vulnerabilities using Jyotish. How can they understand their medical vulnerabilities? And through diet and lifestyle, and we'll even talk about certain panchakarma practices, how can we ensure your life to have the longest, happiest, healthiest life possible, so that we can help you achieve Dharma, Artha, Kama, and Moksha, so we can eventually achieve the Mahasamadhi and spiritual liberation. So I hope that was a nice start to our series, and I hope it got a lot of individuals excited.
Thank you. Thank you so much, Kṣaṇāti. Yeah, I learned a lot every time I do a video with you. So thank you. And I hope everybody enjoyed the video, and we look forward to our second part and talking about different planets. So I have my book and pencil ready and to make all the notes. Thank you so much, Kṣaṇāti.
Thank you, Navjeet. Namaste.